Welcome to the WRAL Daily Download. I'm Megan Glova. A local mom was stunned when her health insurance denied coverage for a $126,000 procedure. Now, when her appeals went nowhere, she sought help from Five on Your Side. Joining us now is Five on Your Side producer Pritchard, and your team was actually able to help get this denial overturned. So tell us what happened there.
Yeah, so we'll kind of start at the beginning, right? She got prior approval for this procedure. She went through all the processes that you're supposed to go through to make sure that you're going to have coverage. She went to her insurance company and said, hey, I need this surgery. They said, okay, go for it. She was going to be covered. She spoke with the hospital who estimated her bill was going to be $0. And, she had the procedure, and come to find out about a month later, that's when she found out about the denial, and it came back and they said, no, we're not going to cover the device that was implanted, which accounted for about $126,000. So that's really where her big surprise came from and getting this, is she thought she had done everything right on the front end, only to find out, no, this isn't going to be completely covered the way that she thought.
When Blue Cross told her that it was going to be covered, was it in writing or was this just verbally over the phone?
Yes, yeah. She said that she had phone conversations. She had it in writing. She shared that documentation with me that, she had prior authorization for the procedure. And then she also got it in writing from Duke, something that estimated her out-of-pocket cost was going to be $0 for the procedure. So she had all of the stuff up front that she thought she would need to be covered on the procedure.
Yeah, and she did try to appeal this, correct? And then they just denied her again?
She tried to appeal it. She went through the channels of appealing with Blue Cross Blue Shield, and essentially what they came back with was the device that they put in her ankle when they did the ankle replacement. They believed or called it investigational, and they don't cover that through her plan. So basically what that means is they didn't have enough scientific evidence to prove that it was going to benefit her life in a way that was worth the coverage. So that was their justification for denying the appeal that she made to try and overturn that decision and have the insurance company pay for the device. But that was their reasoning. They just didn't have enough evidence that it was going to have a benefit.
Okay. And I'm not sure if you guys came across this during your investigation, but wouldn't Blue Cross know this when they were telling her it would cost nothing in the first place?
Right. And I think that, again, goes back to her initial surprise, is that she had gone through the steps. And she, as a matter of fact, had this procedure on the other ankle 4 years earlier.
Oh, okay.
Melissa Koch, she has a condition with her joints that they, degenerate. And basically she needs these replacement joints. She's had them with other stuff, hip, ankle. So she has actually had this procedure with her ankle before on the other ankle, same hospital, same doctor, same device. It was covered, and I believe, though, it was a different insurance carrier. So, aside from that one little change, everything had been fine. She'd already gone through this. She had every reason to believe it was going to be covered.
Oh, yeah. You wouldn't think there's going to be a $126,000 difference there. Now, let's jump to the best part of the story was your guys' investigation. You all reviewed Melissa's medical records. What did you find, and how did that lead to the appeal denial getting overturned?
Yeah, so the denial basically focused on that investigational part that we talked about, that it wasn't covered in there. And what the investigational portion was they said it included 3D parts that came in standard sizes. And essentially that is, they're saying this isn't a custom device. This, we don't know if this is going to work long term. It's not custom to this patient. It's not something that we're going to cover. But when we spoke to Duke, they essentially said that's not the case. There was a 3D model involved in the process of treating Koch. They had a 3D model to make sure that the device was going to work, but that's not what was implanted in the patient. And that essentially is what Duke told us was kind of the misunderstanding there, that there's just a misunderstanding about the actual device that was implanted for the ankle replacement.
Okay, and you guys did get a response from Blue Cross Blue Shield. We'll hear more about that when we come back. Welcome back. So, Pritchard, Blue Cross did own up to their mistake. What did they have to say?
They apologized to Koch. This was a lot to go through. She's been spending several months trying to appeal this decision and really had concerns about what she was going to do moving forward. This is such a big bill. that she believed she was going to be responsible for. Blue Cross Blue Shield apologized to her, said she never should have been responsible for this bill. They mentioned that they understand that healthcare is confusing, and they're trying to make that easier for their customers to understand, especially when it comes to things like this. So, they certainly didn't want to put her in a position where she believed she was in debt for $126,000. They weren't trying to pin all this on her. So, they certainly understood the situation and, ended up reversing that decision, approving the device and therefore covering it.
Good to hear. And I saw you also got some interesting data on insurance denial rates. Can you tell us more about those?
Yeah, so this comes from KFF, Kaiser Family Foundation, and essentially they looked at nearly 400 million health insurance claims. And this is a very narrow window, but they're specific types of claims. And what they found is that there was about a 19% denial rate among those claims, and only 1% of all those claims that got denied were appealed. So a very low rate. When somebody gets denied for coverage, a very small percentage of people were appealing. And then most of the time, the insurer was upholding that initial denial. So they really weren't going anywhere. And, all that data, I know it's a lot of numbers and it can be hard to visualize, but all that to say, Coke wanted to talk to us because she wanted this story to be out for other people to know that, if you get a denial, that's not the end of the road. You can appeal, you can get help appealing, and you should go through every avenue to try and get things overturned because, in some cases it's not a lot of money, but in her case it was. And, you've got to know what your rights are, what your avenues are for recourse as a patient and how you can push back if you believe that a denial was incorrect, especially in her case where she had all those prior approvals. So that was really kind of her message and where that denial data kind of fits in a little bit.
And what would you suggest to people in terms of getting that information? Maybe they're in a similar situation to Melissa, or maybe they're just looking at their bill and thinking it looks a little too high.
Yeah, go through everything. We always advise people, really do your homework on the front end because it's much easier to deal with all that before things happen. It becomes a lot harder if you didn't do the research or didn't get a pre-authorization or something like that, which a lot of insurance carriers are requiring for certain things. But if you do get this denial on the back end, just be really careful with the appeals process because in some cases you only get one shot at it. The rules are different kind of depending on who the insurer may be and what their appeals process and what they allow. So just be really clear going in, how many times are you going to be able to appeal, talk to your hospital and their financial department. Are they able to assist in any way? And you may consider getting professional help in some way, whether that be a lawyer or something along those lines. You can always reach out to 5 on Your Side. We're happy to try and take a look, if you've exhausted other avenues. But really that is one of the things is know the rules. You know the rules going into that appeals process because, if you're only getting 1 or 2 shots at it, you don't want to burn that one appeal if you don't have professional help or know exactly where you're supposed to be going with it. So just be aware.
Absolutely. Pritchard, thanks so much. And good work to 5 on Your Side once again.
Thank you.
And thank you for listening to the WRAL Daily Download. You can find more podcasts from WRAL News at WRAL.com. Search podcast. From sports to true crime, there are plenty of shows to keep you informed and entertained. Thanks for listening. We'll see you next time.